Hello, everybody. This is the Rotary eClub of Silicon Valley, and every week we work to bring you stories of people making lives of others better in all sorts of cool and innovative ways. We are part of Rotary International, 1.2 million members around the globe, and 34,000 clubs, people who come together with a heart for service and an interest in connecting with other people who have the same outlook towards making the world a better place. So our club, the eClub of Silicon Valley, has a special interest in innovation, entrepreneurship, and education. And when we look at the different possibilities for how we get people excited about service, we look for great stories. And we look for those stories however we can find them and wherever they may be. This particular recording, we're going to be talking to someone in our area, in the Bay Area. Dr. Marty Fishman has been a practicing ophthalmologist in Los Gatos, just down the highway, since 1976. He is a Rotarian, currently the president of the Rotary Club of Los Gatos, and today we're going to hear a little bit about the work he has been doing in Guatemala since 2005. Marty, it is great to have you here. Thank you very much for your time.
Thank you. I want to appreciate your invitation, and I'm looking forward to talking with you about our program in Guatemala. We'll just get started. So our program is called Seeing Again Guatemala. It's sponsored in part by the Rotary Club of Los Gatos, as well as the Rotary Club of Santa Cruz. And Guatemala, if you haven't been there, is a gorgeous country. The population is almost a majority of indigenous people with beautiful fabrics, interesting looks, a beautiful volcanic lake, which is the background I'm using today, and 25 volcanoes, some of which are unfortunately very active at times. It's located between Honduras and Salvador to the south and Mexico to the north. And the 18 million people who live in Guatemala are comprised almost half of indigenous Mayan native backgrounds. It's a very rural country with a very young population and unfortunately a very poor population. Half the country are subsistence workers and agricultural workers. There's a high level of malnutrition and a very high level of poverty. One of the towns in Guatemala is Santo Tomas La Union. It's in the highlands of Guatemala in the coffee producing areas. The arrow on the map here shows where it is, just south of Lake Atitlan, at about 1,500 feet elevation. It's about a 3.5-hour drive from Guatemala City. This is the entrance to the town, where there are buses to take people to nearby cane fields where they can cut cane, where they can pick coffee off the plants. And the city is a very interesting city. I've been going to Guatemala since 2005. The population of Santo Tomas is around 10,000. Most of the people speak Spanish, but about almost 40% of the population speak only one of the 25 Mayan dialects. This one is called Quiche. They grow, besides coffee, bananas, plantains, nuts, fruits, and there are trade shops throughout the area, but it's mainly a background for producing coffee in the area. In 1964, this clinic, the Clinica Machena, was built in part by funds from the Diocese of Helena, Montana, when the Pope told American Catholics to go out and help other parts of the world. It serves 40 communities. In 1966, this clinic was built, and it since that time has treated patients for blood pressure, diabetes, simple pregnancies. It has a Guatemalan MD. But in 1996, it began to provide eye medical care. And this was sponsored in part by Santa Cruz Rotary and a group from Montana. Now, since that time, patients make appointments for the every 6-month projects that develop for a week. They call in on their cell phones, they see these posters for the Jornada de Ojos, and they come to have their eye care provided. They line up in front for their appointments. They're scanned by employees at the clinic with their medical history and tested for diabetes, which is a very high incidence disease there. Their vision's tested in the clinic. And the patients we see there, we treat for medical eye problems from glaucoma, allergy, irritation, dryness. But the most important thing we do in a way is we take care of people who are blind. So Guatemala has nearly 100,000 people who are blind, mainly from cataracts. They're blind because they don't have the money or the access to medical surgical eye care. And most of these people who are blind are treatable. In case you don't know, a cataract is basically when the lens of the eye has become cloudy. And this happens with age. It's more frequent in diabetes. It's more frequent in some populations because of genetic issues. Here's a patient waiting for her care. You can see her pupils are dilated and the right pupil is white because the cataract there is opaque. She can't see anything out of that eye at all, except a little bit of light. And with our cataract surgery that we provide there, we can take this opaque lens out of the eye, put a new plastic implant in, and allow the vision to recover from to normal again. The surgery takes 20 to 40 minutes. It doesn't hurt. The patients are provided with an anesthetic to numb the eye, and they recover very quickly. So after waiting, as you can see on the lower left, patients are screened. We have an optometrist we work with the one of the local hospitals in Guatemala City, and then we perform eye surgery in a small operating room where we can only operate on one patient at a time. This is the typical operating room. We've brought down and left there permanently a microscope, medical surgical supplies, a device that we can use to do small incision surgery. We have a video camera set up, and we bring with us usually a Stanford resident where I teach in ophthalmology. And often we work with a Guatemalan resident who's a third or fourth year resident, and we can teach that resident newer techniques for surgery. And they can watch the surgery through this video display. This is one of the newer instruments we're using, which allows us to do surgery through a very tiny incision, as you can see here. Probably half to 2/3 of the cataracts are so advanced that we can't use this device, but this is the standard procedure for doing cataract surgery in the United States. After the surgery, the patients, because they've often come from many, many miles away, can stay there overnight with their family in rooms that are available. The clinic provides them with food. The next day, they're walked up to the clinic from their rooms. They wait, and then their patches are removed. After the patches are removed, they can usually see normally the next day, or very close to normal. We provide them with eye drops. We arrange to have them seen a week or so later by a local ophthalmologist or the resident who's worked with us. Okay, so this is the video we produced 2 years ago. You'll see a speeded up demonstration of how we unload our supplies, which is going to make you a little crazy as it makes us crazy. But this will show you about how we work and about 3 of our patients. We leave from San Jose Airport. We bring about a dozen people. Fly to Guatemala City, and the next morning we're transported to the clinic. We don't really work this fast, but we can do a lot of video displays. People are lined up there this morning.
Yes, primer lugar, ese lugar de acá, Chiltepec es muy pobre.
Sí.
Es muy humilde el lugar. No hay mucho
Trabajo.
dinero para llevar con un buen médico. Los tiempos que él se quedó ciego, nosotros nos estuvimos manteniendo. Yo vendía donas. Él, a pesar de que él estaba ciego, él hacía las donas y yo sabía
para vender.
hacer. Y a Quetzal, yo sé que eso nos rinde darle más dinero a mis hijos.
Sí.
Porque pues no
Sí,
tengo
ayuda mucho.
cómo agradecerle por todo el trabajo que han hecho.
Yeah, he feels very thankful with the Club Rotary Los Gatos because he says it's no way he can pay for the surgery. So very thankful with the Rotary Club of Los Gatos was for his support, for their support to make possible that Dr. Marty Fishman will come with his group and do a better job to everybody here.
So this is just a report we get every year from the people who work at the clinic about our numbers. And at the bottom, you can see that we've provided cared over 9,000 patients over the years, almost 2,000 cataract operations, mostly on these blind eyes. This is the first year we're not providing any visits. This is the week that we would have a group from Guatemala, from Montana there. And the group I was to lead this year is scheduled for October, but I have a feeling we're going to have to cancel that. The project is funded primarily by volunteers who pay for their own travel and the small amount it costs to stay there at the clinic and to get to the clinic. We have large medical surgical supply donors who provide us with the drugs that we use, the medications we give to patients to care for their eye disease afterwards, and for all the surgical supplies. We've also gotten regular small amounts of funding because that's all we really need from Los Gatos Rotary and Santa Cruz Rotary and a few other hospitals and churches. Mainly the funds that we need in larger amount are to buy some of the bigger pieces of equipment or to repair it or restore it. So that's the end of my presentation. And I think I can go back to you.
All right, excellent. Thank you very much, Marty. I'll ask our different participants to activate their cameras so that they can come in as well. And anyone who has a question ready to go, let me know. Let me introduce the people we have on the recording. We have several of our own members, so please wave when I call your name. Cecilia, I see you there. I see Manu in Germany. Ferheen, also in the Bay Area. Angelica, who is in Italy, but a member of the Rotary eClub of Melbourne in Australia. And I think we have another couple of guests with cameras off, but good to have you as well. So Marty, to get us started, I'd like to turn it over to Ferheen for the first question.
Hi, Marty. Thank you so much for
the
invitation. As an aspiring doctor myself, I'm applying to medical school in a few weeks.
Good.
Yeah, so please, send me all your good luck and well wishes. I'm so impressed by the work that you've done, over these years to really help the people of Guatemala. And I hope that I too can be someone who does something like that. So I guess my question though is, I noticed that there are residents, right, of Guatemala who are also participating in these surgeries. Do they end up becoming kind of full-fledged ophthalmologists that then do the surgeries by themselves?
Yeah, Guatemala has mainly in Guatemala City and a city called Quetzaltenango, which is another large city, has medical schools and residency programs in ophthalmology. In Guatemala, it's a 4-year residency after internship and medical school. So we take a 4th-year resident with us for each of the 2 weeks that we're there. They're usually residents who are working in the countryside, and their 4th year at one of the several clinics that their medical school has set up. And they work by themselves. They're already doing cataract surgery, but the surgery they're doing is an older type of surgery because for them to use some of the newer equipment, it's too expensive for them to use it there. So we can teach them how to use it. They have some access to it potentially in the future. But yeah, we love working with a resident. We teach them, although the surgery that we do is more difficult than what we do here in the United States. Cataract operation takes 10-15 minutes. It's about 95 to 98% successful. There, the surgery can take 45 minutes to an hour because some of these patients have hard, advanced, white, dense cataracts. They dilate poorly because of other diseases that they have in their eyes, and it makes the surgery slower. But nonetheless, we can teach them. So we teach them, they learn from us, and most of them really value the experience. They usually have 12 to 14 residents a year, so we only teach a couple of those residents in this program.
Great, thank you.
And Angelica, I think you have the next question.
Thank you. So thank you, Marty. This is a very important project, and I think from what you presented, this is not easy to run such a project. So I wanted to ask you, what are the main challenges that you encounter while you were there and you run the project?
Well, I start usually 6 to 8 months before my group is going to go, which is in the fall, October, November. And I've already a year before the trip set aside a date with the clinic that I'm going to use so I don't interfere with election dates or holidays. I have 2 groups of ophthalmologists and operating room nurses and technicians who usually will go every other year, and they're usually committed right after they finish for 2 years in advance. And so I get about a dozen people. I occasionally bring down a Rotarian from my club who was doing the video photography for that video that I showed you. But mainly I only have room for about a dozen people in the clinic spaces where they have some rooms for us, where they take care of us. And then about 6 months in advance, I have to write the drug companies and ask them for medications and surgical supplies. I have to buy, usually personally, what I'm not going to be supplied with. Some of the medicines they just don't have available to give to us. I have to repair the instruments sometimes. All those devices you saw down there can be taken apart and brought back. What I didn't show you is we have 2 lasers in the clinic, so we can do laser treatments for patients with glaucoma, since most of them fail to take their medicines for glaucoma regularly. They just aren't willing or able to do that. So if we can treat them with a laser, we can control their glaucoma more readily, because a lot of them come in blind and we can't treat them if they have glaucoma, and that's the cause of their blindness. And then traveling there, we worked out a pretty good routine there. I have a travel agency I work with that picks us up at the airport, takes us to a nearby hotel overnight. The next day they drive us the 3.5 hours to the clinic. They come back and get us a week later. We stay in a city called Antigua, which is a gorgeous town about 45 minutes from Guatemala City. We stay there overnight. And we have a dinner with the residents and their partners and their teacher from Guatemala City and the group. And then we fly back the next day. So it's pretty well organized and runs pretty well. The biggest problems I've had in the past have been with transportation. So it gets a little more expensive to travel with United or American Airlines. Sometimes it looked like this year was going to be 2-stop flights, which are a little more difficult. We've never lost any of the baggage along the way, but we're bringing usually 14 huge duffel bags filled with medical supplies. Some things like that big microscope you saw, I had to take apart at home, pack everything in separate duffel bags, and then ship it down and convince the customs people to let us through. They usually let us through now pretty easily, even though they x-ray everything, but that's always been a challenge. We have letters from the public health official in the town and from the Diocese of Helena, Montana about what we're doing. And so usually we get everything through okay. So it's pretty smooth, and that's why the groups I take down want to go back, I think. I mean, I've got the group I took this past year is booked up for 2 years from now, and the group I was to take in November had gone, and basically all of them a year ago. So actually 2 years ago. So I mean, there are challenges along the way. Some of the companies stop providing the things we need, like some of the surgical knives or implants. We have to sort of look around for those. We have to repair things that get broken. So some of the hand pieces get damaged and we have to bring them back and replace them. The laser that we used, part of it came back recently to be replaced. So we just sort of deal with those, but they're all challenges we can mount basically. The biggest challenge we had was 4 or 5 years ago. There were huge storms. They washed out bridges. They had lightning storms that put the power at the clinic out. And we were told at that time that the customs forms we had to have then supposedly weren't going to come through. But we all decided at the last minute when we heard all this information to go anyway. So we flew down and we found ways around the broken bridges and the power was restored. And we had plenty of patience and we had a good time. And so we just go and do what we can do.
Okay, so Marty, so this is something I wasn't aware of, and maybe everyone else is, but when you implant the new lens, can someone who has been nearly blind from cataracts actually see with nearly perfect vision again?
Absolutely, yeah. Yeah.
Oh my gosh.
Because we bring down an ultrasound device that's loaned to us by a company, so we can measure the eye just as we would do here, and it tells us what implant power to use from 5 to 25 or 30, because everybody's a little different. So we have a huge supply of the implants so that we've left there. So we can pick the implant that's going to give them close to 20/20 vision. We can't correct some things. If they have a lot of astigmatism, we don't have special implants like we would have here.
Right.
We don't do bifocal or trifocal implants like we would do here. But most of them end up seeing close to 20/40, which is driver's license after the surgery without glasses. Most of them don't drive. They don't have cars.
Yeah.
Many of them don't read. These implants are monofocal implants, so they would focus their eyes for distance. But we give them free little drugstore type reading glasses so they can read. In fact, some of the patients we see who come in who don't need cataract surgery are worried that they're going blind, but they're really just reaching 50 or so in age and they can't focus anymore. So
Right.
we can give them reading glasses and they can see again, and we make sure their eyes are otherwise healthy and their issues are solved. But yeah, we provide pretty much normal vision to these people afterwards, and they don't come in until they're blind. They're let in by their families seeing nothing. That middle patient, the baker, normally would bake with his brother, forming the rolls and buns, and then they would bake them in their ovens. He was totally blind. Yeah, that stick he had was to allow him to walk around. After the first surgery, he could see normally, and he could work again. After the second surgery, he had binocular, better depth perception vision.
And then my next question, which is quick, is have you been taking advantage of the Rotary Foundation Global Grant Program?
No, but no, this program was started in 1996, and Dr. McKenzie in Santa Cruz, who was one of the starters, who is a Rotarian still,
Yes.
got his club and other clubs to give him some money, but we've never done a global grant. There isn't a Rotary Club in Santo Tomas or nearby. I've just started a literacy project in Santo Tomas for all the elementary schools.
Mhm.
But I'm doing it through my club and personally because, as you know, if you don't have a club nearby and you want to wait a year or two to find a club to get all the paperwork done, you can do it. But I'm just doing it.
We
So
must talk because
I
I can get you that club. I
okay.
can get you a club. Don't
Okay.
worry about that.
Well, okay, good. Well, I've talked to people who are in some of the Guatemala City clubs and in Mazatenango, and I know of some of the projects there. I looked at the Guatemala Literacy Project, but the project we're doing on our own is working great. I was going to go down this week while the other group was working with my school superintendent, who's a Rotarian, to finish up this literacy project in the town. But yeah, I haven't done a global grant, but I'll talk to you more.
Cool. Okay. Well, I was impressed, Martin, even before you told us that you go there during stormy times as well. I was even more impressed after that fact. My question would be, and you talked a little bit to us about that, COVID-19. How does that impact your work? And maybe you can also give us some insights on how does that, from your perspective, impact health system in Guatemala, in your clinic there?
Well, as I said, we had a group that was supposed to be there this week. They canceled from Montana. Our group is scheduled to go October 10th. And I have a feeling that we're not going to go, in part because there still may be issues, and in part because the people I'm bringing are giving up a week of work, a week of vacation, income, and they may not be able to do that as readily. But if I can, I'll take them. The people I work with in the literacy program have written me that in this town, the town has closed access to outsiders and there's no disease. And he's planning to go and start the literacy program, additional schools in a couple of weeks. And he's already received the computers he needs. In the country of Guatemala, they've stopped allowing outsiders to come in. So that was part of the reason why the April group canceled. They have a few cases from what I've heard. I mean, these people are poor. There's no medical care out in those areas. They don't have ventilators. They don't have masks. So I don't know what's going to happen. On the other hand, they don't have a lot of outside people coming in, and they are already pretty much isolated in their homes. But this country is totally impoverished. So as the coffee prices go down, as pests or drought reduce the coffee crop, they're even poorer. As automation hits the cane fields and they can't go out on the buses from this town for an hour drive to the cane fields to cut cane, they're even more out of money and food. They see malnutrition at the clinic in young infants. There are diabetics there. Some of the younger patients we take care of with cataracts are diabetics. And they're having a harder time getting insulin and taking care of their medical disease. So it's a very poor town. It's a very poor country with wonderful people. It's a beautiful country. One day they'll prosper, but you know, they need help. They need help educating the population and taking care of them medically and bringing in simple things that they need. The schools that we're working with have concrete buildings and a couple of desks and no textbooks. The teachers teach on a blackboard. So there's just a lot that can be done there.
Dr. Fishman, thank you so much for everything you had to share. Thank you for the work that you do there, that you do here, the time that you've put into the Rotary Club of Los Gatos as well. And we thank everybody who has taken part in the recording today. If you are watching this recording, we ask you to do two things. Go down, there is an attendance piece, please fill that out. And then also a discussion forum at the bottom of the meeting page. And we hope you'll share your thoughts as we go. Speaking of sharing thoughts and going, we'll finish up with the last idea from Marty. So thank you again, and your final words.
Thank you. Well, I appreciate the opportunity to show this to you. And I just want to tell you, I've been in Rotary for 4 years, and it just amazes me at how much opportunity there is, how much there is that I don't know, that I should know, and how much it brings to the world. And it's great to just be a little part of that. So I appreciate all the work that you've done and all the help that Rotary provides in really serving the world. Thank you.
Thank you again, and everyone, we will see you next week.